So today we're talking about a condition that's often misunderstood, surrounded by a lot of myths, and honestly, it's one of the most complex psychiatric disorders out there. We're diving into schizophrenia. Now, before you click away, this isn't going to be one of those boring textbook definitions. We're going to break it down in simple, real-world terms. First, we'll cover what schizophrenia actually is, then we'll talk about the signs and symptoms, some of which might surprise you. We'll go over how it's diagnosed, what treatment usually looks like, and finally, if you're a student, stick around to the end for some useful exam tips and mnemonics to help you remember the key points. All right, let's get into it. So, what exactly is schizophrenia? Well, schizophrenia is a chronic mental health disorder that affects the way a person thinks, feels, and behaves. People with schizophrenia can seem like they've lost touch with reality. Now, I know that sounds intense, but let's unpack that. It's not the same as having multiple personalities, which is a common misconception. That's actually a completely different disorder called dissociative identity disorder. Schizophrenia is more about psychosis, which means having trouble distinguishing what's real from what's not. Think of the brain like a computer, right? In schizophrenia, it's as if the system is glitching, like the inputs and outputs aren't matching up. You see or hear things that aren't there, you might have thoughts that don't make sense to others, and emotions can get really jumbled. And unfortunately, this isn't just a temporary thing, it's long-term. Now, let's talk about symptoms, because this is where things get interesting. The symptoms of schizophrenia are typically divided into three categories: positive, negative, and cognitive. Let's start with the positive symptoms, and no, positive here doesn't mean good. It just means something has been added to your normal experience, like hallucinations. These are perceptions without an actual stimulus. The most common? Auditory hallucinations, basically hearing voices that other people can't hear. These voices can comment on your behavior, insult you, or even command you to do things. Scary stuff. Then you've got delusions, which are fixed false beliefs, like believing you're being watched by the government through your microwave, or that you have a special mission from outer space. These beliefs don't change even when presented with evidence. Other positive symptoms include disorganized thinking and speech. People might jump from one topic to another with no logical connection, or their speech might be completely incoherent. There's even a term for this, word salad, when someone's words are all jumbled together and don't make any sense. Now onto the negative symptoms. These are things that are taken away from the person's usual functioning. Like imagine losing the ability to show emotion. This is called flat affect. Or being unable to start or continue activities. This is called avolition. There's also alogia, which means reduced speech output. Someone might give really short answers or not speak at all. And then we have cognitive symptoms, which are a bit trickier to spot, but can be super disabling. These include problems with attention, memory, and decision-making. Someone might have trouble focusing during a conversation or struggle to remember appointments. It's subtle, but it seriously affects day-to-day life. Oh, and just a quick note, not everyone with schizophrenia has all these symptoms. It's a very individual condition. Symptoms also tend to come and go in episodes, and between episodes, some people might appear relatively normal. So, how do doctors actually diagnose schizophrenia? Well, first things first, there's no single test. You can't do a blood test or a scan and get a yes or no. Diagnosis is based on a clinical assessment, which means a trained psychiatrist will interview the person, talk to their family, observe behavior, and rule out other causes. The key diagnostic tool is the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders. According to it, to be diagnosed with schizophrenia, a person needs to have at least 2 or more of the core symptoms, like hallucinations, delusions, or disorganized speech, for a significant portion of 1 month, and signs of the illness must persist for at least 6 months overall. They also need to have trouble functioning in daily life, like holding a job, maintaining relationships, or basic self-care. And before a diagnosis is made, doctors have to rule out other possible causes like drug use or a medical condition that could be causing similar symptoms. For example, methamphetamine use can cause psychotic symptoms that look a lot like schizophrenia. All right, now let's talk about treatment. So, unfortunately, there's no cure for schizophrenia, but there are treatments that can help manage the symptoms and improve quality of life. The main treatment is antipsychotic medication. These help reduce hallucinations and delusions. There are 2 main types, typical and atypical antipsychotics. Atypical ones are more commonly used nowadays because they tend to have fewer side effects related to movement, like tremors or stiffness. Medications can take a few weeks to start working, and finding the right one can take some trial and error. Side effects like weight gain, drowsiness, or high blood sugar can be a concern, so regular checkups are super important. But meds are just one piece of the puzzle. Treatment also includes psychosocial support. This can mean therapy like CBT, cognitive behavioral therapy, which helps people manage symptoms, challenge delusional thinking, and improve daily functioning. There's also social skills training, supported employment, and family education programs, which can all make a huge difference. The goal is to help the person live as independently and fully as possible. Oh, and before we go on, if you're finding this video helpful so far, don't forget to give it a thumbs up and hit that subscribe button. It really helps support the channel and keeps this kind of content coming your way. All right, back to it. So, how long does treatment last? Well, it's usually lifelong. Some people might go into remission and have long periods without severe symptoms. Others might need continuous support. But the earlier treatment is started, what we call early intervention, the better the long-term outcomes. That's why recognizing the early warning signs like social withdrawal or subtle changes in thinking is so important. Now let's wrap up with a few quick tips, especially for the students out there. When you're trying to remember the symptoms of schizophrenia, one super useful mnemonic is PANDAS. P, positive symptoms. A, affective flattening. N, negative symptoms. D, disorganized speech. A, attention deficits. S, social withdrawal. Another one that's often used is HDD for the 3 hallmark positive symptoms. H, hallucinations. D, delusions. D, disorganized speech or behavior. Also, for your exams, don't confuse schizophrenia with schizoaffective disorder, where there are mood symptoms like depression or mania alongside the psychotic symptoms. The timing of symptoms is key in distinguishing them. And here's one more. Remember that early onset, especially in teenage years or early 20s, is common, but childhood schizophrenia is extremely rare. And if psychotic symptoms show up for less than 6 months, think schizophreniform disorder instead. All right, final thoughts. Schizophrenia is not a character flaw or something that someone chooses. It's a complex, chronic brain disorder. But with the right treatment, support, and understanding, many people with schizophrenia can lead meaningful and fulfilling lives. So whether you're here as a student, someone supporting a loved one, or just curious, thanks for sticking around and learning about this with me. If you found this helpful, go ahead and share it with someone who might benefit from it. And if you want more clear, down-to-earth medical content, don't forget to subscribe. Thanks for watching, and I'll see you in the next one.